This week is Sleep Awareness Week. Now, sleep is something that we obviously all need, and if we don't get enough and our sleep isn't good enough, it can have serious effects on our overall health and well-being. Many people that think that sleep is a passive process. You close your eyes and it just happens. But in fact, sleep is a very active process. During normal sleep, we cycle through up to five different stages of sleep multiple times throughout the night. And these different stages of sleep are not only important for recharging our batteries, but also are important for helping us process memories and emotions from the day, and also for our interpersonal functioning. Good sleep really is a learned skill, and we have to keep practicing good sleep to maintain it. When our sleep is disrupted, it can lead to both physiological and psychological stress, and this can actually increase our risk of a number of chronic diseases, including heart disease, diabetes, mental health problems, and even some cancers. Sometimes sleep disturbance is caused by what's called a primary sleep disorder, so a medical disorder that causes sleep disruption of some sort. And the two commonest types of primary sleep disorders are sleep apnea and narcolepsy. It's estimated in Australia that actually 2 out of 3 people with obstructive sleep apnea don't know they have it. So it is an underdiagnosed problem, and something that if you are having problems with your sleep, your doctor will likely ask you questions to rule that out. People with sleeping problems will sometimes use caffeine, alcohol, over-the-counter medicines, prescription hypnotics, or other substances like cannabis to either improve their sleep or improve their daytime function. And whilst these measures might seem to work initially, either to fall asleep more easily or to be more alert during the day, they all actually interfere with our normal sleep architecture. So they interfere with the normal stages and cycles of sleep that we go through during the night. For example, benzodiazepines, which are prescription medicines sometimes prescribed for sleep, prevent all but sleep stages 1 and 2. So what that means is that you never actually enter the deep restorative type sleep, and you spend the night cycling predominantly through stages 1 and 2. So that can have significant long-term effects and short-term effects. And caffeine actually blocks chemicals that promote sleep. So whilst that might seem like a great thing during the day, caffeine can stay in our system for up to 24 hours. So even if you think that caffeine isn't affecting your sleep, it certainly may be affecting the quality of your sleep. And the other thing that caffeine, we think in Australia, caffeine is doing in a lot of cases is actually masking sleep disorders like obstructive sleep apnea, so worth considering. The good news is that there are many ways to improve our sleep, and sleep education, psychology and behavioural changes are actually effective for 70 to 80% of people with insomnia, so that's a pretty big number. If you are having trouble sleeping, please consider seeing your GP, particularly if your sleep or your lack of sleep or your poor quality sleep is affecting your daytime function. Better sleep will lead to better overall health and being, and that will make us all happier. Thank you.